94.7, today's Sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 583. Thank you so much for joining me. I really appreciate it. Today what we're doing is we're welcoming Mix 107.9 personality Fitz to the show to discuss how wisdom tooth removal for patients is a process, not just an event. Okay, before we get started on that, let me just remind you, in about 10 minutes, you're going to have a chance to win free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call if you want to pre-program it into your phone is 614-459-9769. 614-459-9769. And also, if you would please go to my office Facebook page and like us, that would be great. We are broadcasting live on Facebook. And also, if you want to follow me on Twitter, it's at Dr. Kvitko. All past episodes of the show are available at thereasonswesmile.com. All right? And so, for those of you that are watching the show, or those of you that are thinking about watching the show, let me just tell you that the picture on the top right corner is panoramic view of Fitz's wisdom teeth before I took them out.
Yeah. Oh, yeah.
And I'm leaving that static right now because I want you to see how buried those things were. They were all horizontally, upside down, inside out, and backwards.
And it didn't feel good. It didn't feel good.
And we scheduled him to have him out because he was starting to have pain from the teeth pushing forward. And if you look at that x-ray, you'll see that even his top one was growing completely backward. Not backwards, but it was growing right into the roots of the other one. Fully formed tooth. It doesn't even look like there should be room for it up there, but it's there. And then the others are laying sideways, and they were real close to the nerve, the main nerve that goes to all of the rest of the teeth and a person's chin and lip. So anyway, okay, so now we talk about wisdom teeth being a process and not an event, and here's why. And Fitz was very thoughtful about his wisdom teeth and put a lot of time and effort into thinking about things beforehand, during, and after. And although his process went like everyone else's, his was drawn out more. It just took a little longer because of how bad these teeth were.
Yeah.
Okay? But some of the things that you brought up to me I thought would be important to share with others, which would be things like, you have to start thinking about this. The minute you decided you were going to have them out, you had lots of things you had to consider. Some of them were, how much was it going to cost? Was probably the biggest, right?
Definitely the biggest.
And
of
how
all
much?
of them, that was
All of
definitely
them?
number one, the biggest concern.
And how much would your insurance company cover was the next biggest concern, which is kind of the same thing.
Yeah.
So what you found was not good, right?
Not enough.
Yeah.
Not enough. Dental insurance was, I don't think it was just my dental insurance. I think in general it wasn't going to cover a whole lot of it, and especially because they didn't cover the sedation part.
Okay.
That was what.
And who wants to have these things done awake, right?
Right. And I don't understand why they wouldn't cover something that's done, a lot of times when you get your wisdom teeth removed. You would think they'd at least cover part of it or something, but it ended up being nothing. So it was like the cost of the IV sedation, they did it by every 15 minutes, and it was like $228 every 15 minutes.
Yeah, something like that. And, I mean, can you imagine an insurance company saying, well, you can't be knocked out for your gallbladder surgery?
Yeah.
So what is it about dental insurance companies that they get away with this kind of stuff, right?
Yeah.
It's just not right. It's not fair. I would imagine that they would want their own children. An executive at one of the insurance companies would want their own child to be sedated for this, right?
Mm-hmm.
So another one was you were concerned about. So I was going to ask you first. I have a lot of questions, but let me tell me about the process of you preparing yourself to have the wisdom teeth out.
Like the day of, or like leading up to it, or
Yeah, leading up to it. You started with the cost. You started with. I mean, there were things like I have to get off work. You have 2 jobs.
Yeah, I have 2 jobs, so I have to make sure I can take the time off. So how many days off do I need to take off? And then I need to get a general idea how much it was going to cost, and ask the insurance company how much they were willing to cover, and then debating on, depending on how much it was going to cost, like was it worth doing right now? Do I want to wait a little bit longer? Like, yes, I was going through pain, but like was it tolerable that I could wait a little longer and save up a little extra money? And
It's close to 2 weeks before surgery. You were thinking about postponing it.
Yeah,
right?
I was thinking about scrapping the whole thing and waiting a little while, because it ended up being drastically more than what I expected.
And then you would have to figure out transportation to and from, and you have roommates, but they're not necessarily
Right.
relatives.
Mhm.
They're just roommates and don't really have an obligation to transport you around, right?
Yeah, because then I almost had a family member have to drive all the way down from up north and take me, and then it was just it was stressful. It was stressful leading up to it. So it's not like it's one of the things where it's like I was still living at home, like most of the people I know. Like they were still living with their parents, and their parents would take them and take care of them and all this stuff. So
Part of it is you're a little older than a lot of folks are when they get them out, by about 8 years or something like that.
Yeah, I definitely got mine out a lot later. So I don't know if my old dentist just was like, yeah, you can wait on it. Yeah, you can do this, or if somehow I wasn't paying attention to the conversation, and my parents were like, well, we don't need to just move on past from this.
Because everything's worse the older we get. And we've heard many stories about just tonsillectomy, how rough that is on adults. And we're talking, if you're 18 when you get them out, it's terrible.
Yeah.
And the little 8-year-olds or whatever they are, they're running around playing with the games in the hospital, right?
Yeah.
Eating popsicles and stuff.
Mm-hmm.
So there is an advantage to having them out younger, and that's why when we see something as bad as yours, we say, well, we need to get these out because it's going to be harder next year, harder the year after, on
Right.
you,
Yeah.
not on us. It's the same.
Right.
At some point, if a person gets, say, into their 40s and 50s, it is harder for us because the teeth become more incorporated into the bone. You don't have that little space to put my instrument in there.
Yeah.
But anyway, then you were also concerned about how much time were you going to miss from work? Not just getting the time off, but how much time would you miss after? And there was no way to know for sure.
Yeah, I mean, it was hit or miss.
And how soon can you go back and that sort of thing. You were concerned about would you feel pain during the procedure?
Yeah.
And
Yeah.
that was a big concern,
Yeah.
right? Did you?
No, I didn't even know what happened. I mean, I just remember laying in the chair, having a conversation with one of the ladies in your office, and then just like he said, okay, we're injecting or
Starting the IV.
starting the
gonna give you
IV, and then it was like I blinked, and the next thing you know, I woke up in my bed at 3 in the afternoon.
that was really cool for me to hear because not only because you were talking to us during, you were talking to us after, you walked out under your own power, and when I called you I think I called you that night late. You don't remember that conversation, I'm pretty sure.
It's a little foggy.
I think
It's a little foggy.
I think you remember the conversation we had the next day.
Yeah, I was gonna say you called me the next day. That one I remember.
Right. And so it's a hard concept for people to grasp, even my own staff, when I tell them that you didn't remember anything until you woke up in your own bed. And they would be like, well, we had a nice talk while we were waiting on his ride, but he doesn't remember
I
it.
don't remember any of it.
I promise you this, if we had said something bad or nasty to you, you'd remember that.
No.
I think.
Maybe.
We don't want
I
to
don't
take
know.
that chance.
I don't think I would. It was so strange to think that it's like I was awake and like knowing what was happening, and then it was just like a blink of an eye, and now I'm waking up in my own bed and just like, oh, okay, well, I don't remember any of this. So I mean, I guess it ended up being a good thing for me because it's not like I want to think about pain or any of that stuff. So I mean, it's a concern. So
Yeah. No, that's really cool. So that's something people should take to heart. They're not only not gonna feel it during the surgery, they're hardly gonna remember the surgery,
Yeah.
which is what most of us want, right?
Mhm.
So let's see. You also were worried about who's going to take care of you when you get home, because again, you didn't have your family in town.
Yeah.
And how will you get your prescriptions? Because you called and you asked, can I get them early, a couple days early, so I'll have them, because my roommate's not going to want to stop at the pharmacy and, you know.
And it ended up being a huge headache. Like, that ended up being insane because, you know, you were prescribing, like, strong pain.
They were opioids.
Yeah, so
and we have this opioid crisis and concern, and it's harder and harder to get them, right?
And they pushed back on it. I mean, they were like, no, he needs to have the procedure before.
They wanted you to have the procedure before you got the pills.
So they didn't think I would
sell them or
skip out on them, and I don't know. But luckily enough, we ended up fighting it out. Well, actually, it was one of the ladies in your office.
Okay, had to call the pharmacist.
And she did a fantastic job, and they said you can pick him up, and I picked him up. On my way to the procedure, I picked him up.
Oh, okay. So that's something to keep in mind as well. Now, typically, when somebody comes in, what we do is whoever brought them will say it's the mom or the dad or something and say, now, would you like to go get Fitz's prescriptions while he's in the chair? That means you don't have to sit in the reception room and be bored,
right?
You know? And they usually take us up on that. So the first thing that happens is once we get our patient situated in the chair, family member runs and gets the prescriptions and there's no problem. And so pharmacists should be listening to this, who are listening to this, should realize there are instances where the person needs to have them the day before or a couple days before based on their life, the way their life is going, you know, life's events. Because they do have the latitude to do that.
Yeah.
Now, I've always been careful about prescribing any medication if I haven't seen the patient or if I'm not going to do the procedure till Monday. Let's say it's Friday. If I give the person the medications that they would need on Monday, on Friday, I would say 90% of the time they don't show up.
Yeah.
I feel fine. They still have the abscess. They still need the procedure if it's a root canal, for example.
Right.
But then they tend not to show up. And that's a problem because now the next time they want to get on the schedule to have it done, what do? You already have your prescription. What are they going to, if they're going to be honest with me and say, well, I use them.
Right.
Which is probably part of the opioid problem that we've been dealing with.
Yeah, but I also told you, too, I didn't want to...
You didn't want opioids?
I didn't even necessarily want them, but the only reason I took them was just based on how much pain
you thought you'd be in?
Thought I would be in, yeah.
Yeah, and I've had mine out, and I know what that pain is like. So people listening, including medical professionals and pharmacists, there are times when you need opioids. Let me just throw that out there. It's true. You just need them. None of you would want to have, I don't know, your leg amputated without the ability to have some pain control afterwards. Okay. So, now it looks like I'm looking at the clock, and I said we'd be giving away flowers in about 10 minutes. So, probably about time to do that.
Close enough.
Yeah, close enough. All right, so we're going to do Dr. Kvitko's question of the day. You're going to have a chance to win free flowers from DeSantis Florist coming up here in just a couple minutes. But before we do the contest, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, and as you know, with me in the studio is Fitz, a 107.9 personality. He does the 7 p.m. to midnight every weekday on Mix 107.9, a sister station. And we recently took out his wisdom teeth. And so which of the following are some of the questions and concerns Fitz had before I removed them? Was his concern A, what is the cost and how much will my insurance cover? B, will I feel pain during this procedure? C, how much work will I miss? Or D, all of the above. All right, the winner's going to receive those free flowers from DeSantis Florist. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind, and there's there's nothing else in the world tonight. She said, people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko! Let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We have Tanya on the line. Hey, Tanya, how are you? Hello?
Hello.
Hey, Tanya, how are you?
Good. How are you?
Good, good. Do you have the answer to Dr. Kvitko's question of the day?
Yes, it's D.
It is D, right? It was.
Yep.
What's the cost? How much work am I going to have to miss? Is it going to hurt? All of that stuff, right?
Right.
Hey, Tanya, what do you do for a living?
I'm a preschool teacher.
What kind of teacher? Preschool.
Preschool?
Okay, preschool. For a minute, I thought you said principal. You teach principals.
Oh.
Anyway. Hey, have you had your wisdom teeth out?
I have.
Okay. Can you relate to this?
I can.
It wasn't as bad as you thought, or was it worse than you thought?
It wasn't too bad.
It wasn't too bad. Okay. Well, that's good. Hey, thank you so much for listening and for calling in. And if you'll please stay on the line, Fitz will get the information from you as to how we can get those flowers from DeSantis to your door, okay?
Thank you.
You're very welcome, and thanks for listening. All right, if you're just joining us, this is Dr. Kvitko. This is The Reasons We Smile. It's episode number 583, and we've been talking to Fitz. He is a 107.9 radio personality. He does the 7 p.m. to midnight shift on Mix 107.9, which is a sister station of Sunny 95. And so, yes, I took out his wisdom teeth, and he's a very thoughtful person. He's very detailed, kind of like OCD, but in a good way. And so what we found was this kind of, I've been through this many, I don't know, thousands of times. I've taken out people's wisdom teeth in my 39 years, right? And so for me, it had all been compressed into, you come in, you get your teeth out, you go home, you take your medicine, and everything's fine. But the fact that I know Fitz and I'm around him a lot, kind of like almost put it in slow motion for me. It kind of expanded it and allowed me to maybe reconnect with the fact that this is a process in a person's life, not just an event. You don't just come in and get them out. You have all this preparing to do beforehand, you know, all of his concerns, which we've already talked about. And then the during, you know, now we actually did a little interview of him right before we took them out. The soundbite is at home. I forgot to bring it. Sorry about that. But I actually was recording when we were starting his IV and that sort of thing. And, you know, putting in the medicine, and he was telling me what he was thinking. But I'll tell you this, when I put the IV in, when I start the medicine, the drugs, and I use Valium, I use Dilaudid, I use Compazine, not Compazine, what am I saying, Benadryl.
Yeah.
And so I told you that you're probably going to either feel heavy, you're going to get a cough, or you're going to get a funny taste. And I believe you got all of them.
I think so.
Yeah.
I don't remember. I just remember just kind of like sitting there and talking to one of the ladies, and then it was just like.
And then you woke up in your bed.
And I woke up in my bed. Yeah.
Well, that's to me that's like the best thing we can hear.
Best
that people
case
can
scenario,
hear.
yeah.
Yeah. It went really smooth from our end, by the way. And even though those of you that looked at that picture of his wisdom teeth, and there are several examples here that I'm showing you on the video, his are the worst of any of the ones that I've shown you. And I, went online and looked at a bunch of pictures.
We're so lucky.
Yeah. So, Some of your other concerns were how long would the surgery take?
Mhm.
People are always concerned about that. And I almost hesitate to answer because everybody's different.
Yeah.
They're different. But if I tell the family an hour and a half and it takes an hour and 40, they're nervous. What's going wrong?
Right.
Something must have gone wrong. The concern was, would the IV put you out completely? I think you asked me that.
Mhm.
The reality is, folks, what I do is officially called conscious sedation. That's why you were talking to us.
Mhm.
But you're so sedated you don't remember it, so you may as well have been out completely.
Yeah.
I don't do general anesthesia in the office, but I do conscious sedation. And when people hear that, they go, "I don't want to be awake." And I go, "Believe me, you're not really."
Yeah,
gonna
you're not
be."
awake. You're not awake. You to you, they're awake because
Yeah.
you're.
Yeah, and
you're
if I say
talking to
open, you open,
Yeah.
and you're talking to us.
But if you're the one under the sedation, you're not awake. You're not awake. Do not fear. You're gonna be fine.
So then you were curious, what would you be able to eat afterwards? When would you be able to eat? Would you be able to drink? The answer to what can you eat is, I tell people avoid spicy foods like hot sauce type foods. Avoid super hot temperature foods. Just have moderately temperature foods without a lot of spice. Eat homogeneous foods like pudding and mashed potatoes and tomato soup rather than chicken noodle, because we've just taken teeth out. There are holes in your mouth, and you don't want little pieces of chicken and noodle falling into the holes.
Yeah.
So having homogeneous foods is the way to go. You can drink afterwards. Again, nothing too hot, but we tell you don't drink with a straw, right? Don't,
Right.
And don't.
But I drink water mostly, so it was like that wasn't like a big deal.
And don't smoke, which you don't anymore,
Which
do
I
you?
don't anymore. That's right. I quit smoking that day. So we're 32 days now. 33,
Wow.
something like that.
So it's also Dr. Kvitko's smoking cessation plan.
Yeah, because we had a few different guests of yours come in and mention that to me, quitting smoking, and I'm like, yeah, okay, whatever, no way. But with this, it was weird. It's like that was it. And I stopped smoking, and I haven't smoked since. So.
When was the Franklin County Health Commissioner Joe Mazzola?
But he was the middle of February. No, he would have been like probably like end of January, I think, right?
Yeah, about a month before your procedure,
Yeah.
I think. And so if you're listening, Joe, congratulations. You had a part in helping Fitz stopping to smoke.
Mm-hmm.
So yeah, he has not smoked. The reason you can't smoke, folks, after an extraction is because that back pressure, you can suck the blood clot out, and if you do that, you get a dry socket, and that's even worse pain
That was my biggest fear afterwards.
than you've been through. So then the question also comes up, will I have stitches? Will they be dissolvable?
Mm-hmm.
Okay. Now, I usually put silk in, but I think I put dissolvable in you.
You did do dissolvable, yep.
Because of your life. You have a busy life, you have 2 jobs, you work crazy hours, and I knew it might be hard for you to find a time to come in. And although I want you to come in, and you did, I didn't want you to have to come in the event that you were too busy to come.
Right.
Okay. So we used the Vicryl sutures, which last a little longer than silk, actually. Than gut. They last a couple weeks on purpose. And then the question is always, can I brush right afterwards?
Mm-hmm.
And the answer to that is kind of yes and no. You can brush the areas where we didn't do surgery, but we want you to leave that tissue alone. And something you learned after the fact was the incision comes pretty far forward, right, on the bottom ones?
Yeah.
Yeah, it has to. If we don't make the incision that far forward, we don't have enough tissue out of our way to see and work.
Mm-hmm.
Okay, so that was one of your surprises is, I got this tissue, like it's right up here in the front. It felt to the front like to you.
It felt weird. It was a weird feeling, like not like a red flag kind of feeling. It's just like, well, this is just it's just a weird feeling to me.
Yeah, why do I have loose tissue up here when my tooth was way back there?
Yeah.
Looks like we're almost up against another break, right?
Mm-hmm.
Okay, so let's go to a break. We're talking with Fitz from 107.9 Mix, and we'll be right back.
You can't take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su sesión favorita. Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
All right, we're back. I'm Dr. Kvitko. This is The Reasons We Smile. It's episode number 583, and in the studio with me is Mix 107.9 personality, 7 p.m. to midnight, Fitz. And so he was generous enough, kind enough to talk about his experience with me taking out his wisdom teeth. And by the way, it wasn't all great. I mean, you didn't remember much, but then you've had some pain, and it, it's something that people need to know, that you could be one of those that has a little bit of lingering pain.
Yeah. A lot of things that were interesting, and it lasted so much longer afterwards.
I think I figured out that every step of the way it probably was multiplied by 4 for you. So if somebody, their swelling only lasted a day, yours would last 4 days. If their pain only lasted a day, yours would last 4 days.
Yeah.
So, okay, so you talked about how soon can I go back to work? What restrictions? This is one that we missed.
Yeah.
I didn't remember or realize that your job is, the other job is essentially like very physical.
Labor.
Yeah, you're lifting and moving and lifting. And I tell people, don't do anything that's going to make your heart beat faster. So don't go jogging, don't go working out on your elliptical, or don't go lifting weights, because that's going to get your heart beating and your blood pumping faster. And that would make these wound sites hurt. Yeah. And that's what happened initially.
Oh, yeah. And it was brutal. It was. I had to take a couple of extra days off because I didn't know. Like, I not something I knew. And it's just like, I am just in so much pain.
I mean, I knew where you worked, but I didn't realize it was like exercising all day.
Yeah.
Okay.
Yeah.
So that's one I missed. Sorry about that.
No, it's okay. We figured it out eventually.
Those of you out there that are about to have yours out, if you have a physical job, one that is essentially like exercising, make sure you tell your dentist, okay? And then maybe you can get an excuse for being off work a couple more days. I think you were concerned about what if the medications upset your stomach? What if they upset your sleep pattern, which I think they did.
Oh, yeah, because I had to sleep sitting up a lot longer. Like, it was supposed to, most people, what is it, just like a couple days, a few days, something like that. And I was like 2 weeks.
Yeah, everything was multiplied. And then how long before your gums healed completely and you were feeling back to normal? I know you asked me that question. And yours was probably about a month? I think it was 3 weeks. There was like a light went off. You said all of a sudden from one day to the next at about 3 weeks. It was like, wow, I think I'm feeling better.
Feeling better, yeah.
But it still took another week or so. And you still have holes in your head.
I still have holes. Yeah, they're just on the bottom. The top one, I'm pretty sure is pretty good. Just on the bottom. The bottom left one is a little bit more more open than the one on the bottom right. The bottom right one seems to be trying to get to the end zone and finish closing. So
right, and these are gaping holes.
Yeah.
Yes, we stitch it up, but
you can only stitch so
you
much.
can only stitch so much, and then the stitches dissolve, and there's this little seam, and so people have to be careful not to let food fall in there. The other thing that happens, and it happened in you, is after a day or two you start to get an odor. And you got that.
Yep.
And you were concerned about that, and of course yours lasted longer. Yours lasted a few days instead of just a day. And so, folks, that is normal, as you have, basically what you have is a combination of new cells growing and old cells sloughing. So some of the cells on top are going to slough off, they turn white, they die, okay? And the new ones come from underneath. So when you cut yourself, let's say you cut your arm, you see the scab, you don't know that they're new cells, you don't see the new cells growing underneath.
Yeah.
Which is why if you just leave it alone, at some point the scab just falls off and it's like, hey, I have skin there.
Yeah.
It's back to normal.
Yeah.
Same thing in your mouth, it just takes a little longer because the mouth is a dirty place, lots of bacteria. You keep putting new food in and new drink, and so it's always being kind of reattacked. Okay, and then the other thing that you had mentioned, and I was looking at some of the notes that you had, so we talked about taste. And one of the things is, like you said, it was difficult for you because you didn't know what to expect.
Yeah.
You'd never been through it before. How could you?
Yeah, right.
Nobody knows what exactly to expect.
Mm-hmm. And everyone's different. I mean, mine, when you have your wisdom teeth literally grow in sideways, and, most people it's like at an angle, but mine legitimately came in sideways.
Sideways.
Like there was no other direction but sideways.
And on top of that, the roots were real close to that main nerve, so I had to be super careful, which means I had to, in advance, purposely take them out in smaller pieces, so there'd be no pressure on that nerve area.
It's still, I mean, you could still, like, once I actually processed where the nerve was, I could say, yeah, it's like irritated, not like it hurt, but it was like you can tell. Like
it has some healing to do because it was disturbed.
Yeah,
not destroyed, but disturbed. I think we're out of time. Are we out of time?
Yeah, we're right about there. Right about.
So, hey, thank you so much, Fitz, for being willing to talk about this. Hopefully, you've helped some other people that are about to have them out. But that is all the time we have, isn't it? Okay, so I got to say goodbye before we both get in trouble. All right, so don't forget to follow me on Twitter at Dr. Kvitko. Visit my office Facebook page and like us. It's Dr. Kvitko and Associates. Remember that all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588.